Don't let side stitches ruin your run or make you have to end a run early. Side stitches are basically a cramping, a spasming of your abdominal wall, your core muscles, after running with certain form or after breathing inappropriately. I'm Dr. Christina, the Picky PT, and I'm going to talk to you about how to be picky about your running form so you don't end up with side stitches. I'm also going to tell you what stretches you can do if you're experiencing side stitches to make them go away and be able to continue on with your run that day. So make sure to like and subscribe to this channel if you enjoy seeing content just like this. So like I mentioned, side stitches are essentially a spasming of your abdominal wall. Your core muscles make up your abdominal walls, and there's not just one large core muscle that is surrounding your body. You have 4 different layers of core muscles. Some of those you may be familiar with, your obliques, such as your external obliques that cinch you in tighter, or your rectus abdominis that is used for crunches. But I want to talk to you today about your transverse abdominis and your internal obliques, which are the deepest core muscles that you have. Your transverse abdominis is responsible for lengthening your spine by tightening the core all around you, and your internal obliques are responsible for widening your trunk and creating more room in your rib cage, in your abdomen, for your organs, but also for reducing spasming in those muscles. Oftentimes when we overuse our external obliques or overuse our side bending muscles as we're running, we'll end up with those side stitches. So when you're looking at your form while running, what you don't want to see is running where you're kind of leaning to one side. If you happen to notice one of your running buddies doing this, or you notice that your shoulders are a little uneven while you run, this is something that you want to pay attention to. Instead, you want to imagine that you are pulling your pubic bone towards your belly button the entire time that you're running, and as you're running, you want to think about expanding your rib cage out to the side. So when you breathe in, you want to think about drawing your rib cage back towards your spine rather than allowing your rib cage to open more on one side or open towards the front as you're running. If you try everything you can to avoid side stitches but you still end up with them, I'm going to show you some stretches that you can do to help with that. So first off, it's going to be helpful if you have a surface to hang on to. Since most side stitches are caused by spasming of the abdominal wall and side bending as you're running, you're going to want to open up the side that you've been cramping down on. So you're going to lean away from the side that you're experiencing the muscle spasm on, really trying to cause a C in your body on this side. So you don't want to just hinge at the hips and move at one level. You want to try to create a nice long curve throughout your whole body. Reaching the other arm over, and then we're going to take a breath into this side like so. Now to do this properly, notice that I'm not breathing forward into my rib cage like this, because that's just going to continue contributing to spasming in the abdominal wall, especially if you're having spasming in the back. You have to make sure that you're holding your transverse abdominis muscle, pulling that pubic bone up towards your belly button, and then you're keeping your rib cage down towards your spine, pulling backwards as you breathe in. Do this for about 3 to 5 breaths, taking as long of an inhale as possible, and when you exhale, tightening your core even more in order to stretch out that muscle spasm. Another stretch that you can do is child's pose in standing. So you're going to put both hands on the surface, back up, and then you're going to pull that pubic bone towards your belly button using that transverse abdominis muscle. You'll notice that that rounds my back. You're also going to try to draw those rib cage back towards your spine so you get a nice curve, a C curve in your back. And then we're going to breathe in and breathe out, tightening our core even more, not letting it loose as we breathe out. So it's going to look like this. If you feel like you're tighter on one side of your spine more than the other, you can reach one hand over to the opposite hand, and while you're leaning back and creating that C curve back like here, you can also create a C curve in the side at the same time, and breathing into just the one side to open up that spasming abdominal wall. Like I said, do each of these for about 3 to 5 breaths, and that should help to calm down any spasms that you're having so you can continue on your run and not have to quit early because of side stitches.